All right, today we're going on a pretty incredible journey, but we're not going to some distant land. Nope, we're going inward. We're going to explore the amazing world inside every single one of us, using general anatomy to, pull back the curtain on all the hidden stuff that makes us tick.
So let's kick things off with this really powerful idea from an anatomist back in the 19th century, Joseph Herdel. What he's saying here is pretty deep, right? The whole science of anatomy is built on this fundamental principle that by respectfully studying those who have passed on, we can learn so much about how to help the living. It's kind of like taking a watch apart to truly understand how it tells time.
Okay, so if we're going to be explorers, what's the first thing we need? A map, right? And a common language so we all know what we're talking about. Well, anatomy is exactly the same. Before we dive into all the cool systems, we've got to get the basics down. The body's universal map and its special directional language.
And here it is. This is ground zero for everything we're going to talk about. It's called the anatomical position. And it is absolutely crucial. Standing straight, looking forward, arms at your sides, and, this is key, palms facing forward. So why all the fuss? Well, it gives everyone a single, standard starting point. Doesn't matter if a patient is lying down or sitting, all the descriptions of up, down, front, back always refer back to this position. And make sure a doctor in Tokyo and a doctor in New York are talking about the exact same thing. No confusion.
So, to actually use our map, we imagine slicing the body in 3 different ways. These are called planes. First up, you've got the sagittal plane. Just picture a vertical cut right down the center line, splitting the body into a left side and a right side. Simple as that.
All right, next is the frontal plane, sometimes called the coronal plane. This one is also vertical, but it slices the body from front to back. Think of it like this. It divides you into a front half and a back half. It's like you could separate the anterior part, that's the front, from the posterior part, the back.
And the last one, the transverse plane. This is the horizontal one. Yeah, it's basically the classic magician sawing a person in half trick. It cuts the body into a top part, which we call superior, and a bottom part, the inferior. So with these 3 planes, sagittal, frontal, and transverse, we've basically created a 3D grid system for the entire human body.
Okay, so those planes give us the language we need. It's like a built-in GPS. Superior just means closer to the head. Inferior means closer to the feet. Anterior is your front, posterior is your back. And then you have medial, which is anything closer to the imaginary midline of your body, and lateral, which is anything further away from it. That's it. With just those words, we can pinpoint exactly where anything is.
All right, we've got our map, we've got our language, so now it's time for the really fun part. Let's head inside. And we're going to start with the big stuff, the systems that give us our shape and let us move around, the skeleton and the muscles. You know, it's easy to think of the skeleton as just, well, a bunch of dry bones. But it's so much more. It's a living, dynamic framework for your whole body. Think of it like the scaffolding of a building. In adults, it's made of 206 different bones, and it does 3 huge jobs. It gives you your shape, it protects all your important squishy bits like your brain and heart, and it's what your muscles grab onto to make you move. And what's really cool is that not all bones are the same shape. And that's on purpose. You've got long bones in your legs for power and leverage. You have all these little short bones in your wrists and ankles for delicate movements. Then there are flat bones, like your ribs, designed for protection. And finally, you've got these weird, irregular-shaped bones like your vertebrae. Every single bone is custom designed for the job it has to do. So if the skeleton is the frame, what makes it move? That's where the muscular system comes in. These are the engines. They're the motors that are attached to that bony scaffolding, and they're what pull on it to bring it to life. Literally every single thing you choose to do, running, typing, even just blinking, that's your muscular system at work. I mean, just look at this. It's mind-boggling. We're not talking about a handful of muscles. We're talking about more than 600 of them, all layered and woven together. And here's the fun fact for you. Your biggest muscle is your gluteus maximus, right? But the one that can create the most pressure? It's the masseter muscle in your jaw. All of these muscles have to work together perfectly, like an orchestra, to create the smooth movements we don't even think about. So how do you attach an engine to a frame? With a really strong cable, right? In the body, that cable is called a tendon. You can see how the muscle fibers all come together into this super tough rope-like tendon, and that's what anchors onto the bone. So when the muscle shortens, when it contracts, it yanks on that tendon, the tendon yanks on the bone, and boom, you get movement. It's a simple, elegant, and incredibly effective lever system.
Okay, so we've got a frame and we've got motors, but that's not enough, is it? You need fuel and you need a control system. So let's go a layer deeper and look at the networks that power everything and tell it all what to do.
First up, the power supply, the cardiovascular system. The best way to think about this is like a massive nationwide highway system. It's a totally closed loop of roads. Those are your arteries and veins. And the blood cells are the trucks, constantly driving around delivering vital cargo like oxygen and food to every single house, or in this case, every single cell in your body.
And this side-by-side really shows you how it works. On the left, that's your arterial system. These are the main highways leading out of the city, the heart, carrying all the fresh, oxygen-rich blood. Then on the right, you've got the venous system. These are the roads coming back into the city, bringing all the used-up, oxygen-poor blood back to the heart and lungs for a refill. It's a perfect two-way system.
All right, so if the cardiovascular system is the delivery network, what's telling everyone what to do? That would be the nervous system. This is mission control. It's the body's super fast internet, its electrical grid, its command center, all rolled into one. It's in charge of absolutely everything.
Just take a second to look at this web. It's incredible. Every single one of those fine threads is a nerve, which is basically a biological wire. Tiny electrical signals are zipping along these pathways at incredible speeds. They carry orders from your brain out to your body, move your arm, and they carry information back to your brain, hey, that stove is hot. Literally, every thought you have, everything you feel, it's all happening on this network.
And we can basically split this whole system into two main parts. First, you have the central nervous system, the CNS. Think of this as your computer's main processor. It's just your brain and your spinal cord. This is where all the thinking happens and all the big decisions are made. Then you have the peripheral nervous system, the PNS. That's all the other nerves, all the cables that branch out from the brain and spinal cord to connect to, well, everywhere else. They're the ones carrying the messages to and from the central processor. Now, for most of human history, the only way to see any of this stuff was, well, through dissection. But the amazing thing is, today we don't have to. We have technology that lets us peek inside a living, breathing person and see all these incredible systems in action. And it has completely changed the game for medicine. Let's start with the one we all know, the X-ray. It's a classic for a reason. Basically, it shoots a type of radiation through your body. Your soft tissues don't block much of it, but dense things like bone do. So the bones show up as white on the film. That's why it's still the go-to for checking for a broken bone. Okay, now a CT scan is like an X-ray on steroids. Instead of just taking one flat picture, the machine spins around you, taking a whole bunch of X-ray images from every angle. Then a powerful computer stitches them all together to create these super detailed cross-sectional slices. It lets doctors see everything, organs, bones, blood vessels, in a way that's almost like a 3D model. And last but not least, the MRI. The big difference here? No radiation. Zero. Instead, it uses incredibly powerful magnets and radio waves. And its superpower is seeing the stuff that X-rays and CTs struggle with, the soft tissues. If you want a crystal clear picture of muscles, ligaments, or cartilage, say, to diagnose a knee injury, the MRI is what you need. The detail is just stunning. So there you have it. From the basic map that helps us navigate, to the complex frameworks and networks that keep us going, and finally to the incredible tech that lets us see it all happen in real time, the human body is just a universe of its own, isn't it? So after this quick tour, I'm curious. What part of this amazing, intricate map that's inside of you right now, what part amazes you the most?